Hi, my name is Candace Dale, and I'll be performing a physical assessment for Ms. Carolyn Dolan for Nursing 518. Here we have my patient Hamela. Ms. Hamela, will you state your last name? Brantley, okay. Patient's oriented person. And do you know what month it is? That's right, it's September. Do you know where you are? That's right, you're in the living room. So patient's oriented to person, place, and time. Miss Hamela, can you tell me, where was it that you were born? Okay, born in Valdosta. Okay, I'm going to have you repeat 3 words for me. I want you to repeat them immediately back to me, okay? Meow, 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 meow. Okay, immediate memory intact. I want you to remember those 4 words. I'm going to ask you again later in the physical exam, okay? All right, now I also want to perform some calculations with you. Can you subtract 7 from 30 for me? And again. One more time. Okay, calculation intent. Now, can you tell me what it means when the early bird catches the worm? What does that mean? Okay, so abstract reasoning intact. Okay. And as far as judgment, let's say you were driving. I'm going to invite this video with Hamela. Okay, Hamela, so let's say you were driving down the road, you were driving a little reckless, and you saw some blue lights behind you. What would you do? Okay, patient judgment is intact. I'm going to go ahead and check the cranial nerves at this point, starting with the olfactory nerve. So, Hamela, I'd like you to occlude one of your nerves for me and have you identify the smell. That's right, it's vanilla. Okay, go ahead and occlude the other one for me. It's immediate as well as time. That's right, it's alcohol. Okay, now we're going to go ahead and check the optic nerve. Hamela, can I get you to read this one? Okay. Cranial nerve number 2, the optic nerve is intact. Now we're going to go ahead and move on to the oculomotor nerve, this cranial nerve number 3. And to do that, we're going to be using the pen light, going to look at the pupils. We're going to check to see that the pupils are equal, round, and reactive to light, which they are. Perfect. Now we're going to move on to cranial nerves number 4 and number 6. Cranial nerves 3, 4, and 6 are checked together. Cranial nerve number 4 is also known as the trochlear nerve, and cranial nerve number 6 is the abducens nerve. Cranial nerve number 4, that's going to be controlling the inward eye muscles, and cranial nerve number 6 is the lateral eye movements, okay? So Hamel, I'm going to have you follow my pen light, okay? I want you to keep your head still and just move your eyes. Okay, and cranial nerve 4 and 6 are both intact. Now we're going to move on to cranial nerve number 7. Pamela, I'd like you to raise your eyebrows for me. I want you to squint your eyes real tight. Go ahead and smile for me. Frown. Fight your cheeks. Okay, perfect. We're also going to show you the trigeminal nerve, that's cranial nerve number 5. And how we're going to do that. Can I get you to we're going to assess the patient's jaw. Okay. Can you open and close your jaw for me? Okay. Symmetrical, strength intact. Okay, I'm also going to use this check for sharp and dull sensations. I'm going to rub this cotton swab across your face. I want you to tell me yes when you feel it. And can you identify if it's a dull or sharp? Okay, now we're going to move on to cranial nerve number 8, which is the acoustic nerve, that's hearing. And we'll close your eyes. And I want you to tell me if it's your right or left ear where you hear a sound. Okay. Cranial nerve number 8, acoustic nerve intact. We're going to go ahead and move on to cranial nerve number 9, which is the glossopharyngeal nerve. Which would be checking for a gag reflex normally. So I do have my tongue depressor, but it's very uncomfortable for patients, so I'm going to go ahead and skip that. But I'm looking for a normal gag reflex, symmetrical. Cranial nerve number 10 is the vagus nerve. It also has to do with the mouth, so I'm going to open your mouth for me. Uvula is midline and palate raises symmetrically. We're going to move on to cranial nerve number 11, which is the spinal accessory nerve. I'd like you to press against my hand and rotate your head left. Okay. On to the other side. And show your shoulders for me. Okay, cranial nerve number 12 is the hypoglossal nerve. So go ahead and stick your tongue out for me. Okay, move that left to right. Okay, perfect. Now if I can just have you, we're going to do rapid alternating movements, okay? I want you to use your fingers and go just like that for me. Okay? Go ahead and do your other, just like this. Okay? Now I want you to touch your nose to my finger, okay? Go ahead and do that. Yep. Oh wow, perfect. Okay, so fine motor is intact as well. Now if I could get you to stand up for me, I want you to put your hands by your side, close your eyes, and I'm going to watch you for 10 seconds. Okay? And right now I'm looking for any excessive swaying, any inability to maintain posture, things of that nature, which Pamela is normal at this point as a normal Romberg test. Okay, so now we're going to go ahead and we're going to move on and do some of the tendon reflexes. So to start, we're going to go to the patellar reflex here, and I'm going to use my stethoscope to do that. Okay, so that's +2. Now we're going to go ahead and check the tricep and the bicep. We're also going to check the Achilles, looking for plantar flexion when we do that. Okay, and then all reflexes seem to be +2. We will repeat on the opposite side. I'm going to save some time. I'm going to just do this on one side. Next, we're going to go ahead and move on to the abdominal assessment. Can I have you lay down for me, please, Pamela? Okay, now I'm doing a general inspection. At this point, I'm looking for symmetry. Again, symmetrical. I don't see any distension. Are you having any pain in your abdomen, Pamela? Okay. Pamela's abdomen is obese, non-tender. Okay. I'm going to go ahead and listen. I'm going to go ahead and start in the right lower quadrant, okay? And I'm going to be listening for vowel sounds in all 4 quadrants, okay? Okay, patient has normal active vowel sounds in all 4 quadrants. And while I'm here, I'm going to go ahead and listen for the aortic bruit, which I don't hear. Now, Hannah, I'm going to palpate to see if you've got any tenderness, okay? First, I'm going to do light, and then I'm going to move on a little bit deeper, okay? I'm going to do that in all 4 quadrants. Tell me if you feel any pain or tenderness. Okay. All right, perfect. Now I'm going to go ahead and see if I can feel for your liver on the right side. Go ahead and take a deep breath in for me. Out, and I don't feel it. I'm going to move on and do the same thing with the spleen over here on the other side. Splenomegaly noted. Okay, now I'm going to check for your kidney. Take a deep breath in, out. Okay, and I do not feel a kidney. I will repeat on the opposite side. This is a normal finding. I'm looking forward to trying to catch the kidney. At this point, I don't see it. Okay. Go ahead and check for CVA tenderness now. I know that this is vaginal tenderness when I do this. And I'll repeat on the opposite side as well. Check for that. We're going to go ahead and move on to cardiovascular assessment. And first palpate. Okay, and we don't feel any lifts or heaves when I'm palpating on the point of maximum impulse. Okay. go ahead and take a listen. We're going to start on the right second intercostal border over the aortic, otherwise where S2 is best heard. And we're going to move to the left intercostal, the left second intercostal border to go over the pulmonic valve. You can listen there. You can also go to the third intercostal space on the left sternal border. And at the fifth, which is over the tricuspid valve. And I'm going to move about the mid-clavicular line over the fifth intercostal space. This is the point of maximum impulse. It's also where the mitral valve is, and it's also where I'm going to be doing a real quick heart rate over the apical pulse. So. Okay, looks like Hamlet's heart rate is around 70, which is a normal finding. I didn't hear any clicks, rubs, murmurs when I was listening. Also going to check for any bruit over the carotid arteries, which I don't hear. All right, I'm going to go ahead and palpate the carotid artery. Okay. So that's 2+, that's a normal finding for the carotid artery. Now I'm going to check your radial pulses as well. Those are both bilateral and symmetrical at 2+. Now I'm going to go ahead and check your posterior tibial pulses, symmetrical A+, and I'm going to check your dorsal tibial. Okay, liver symmetrical at 2+ as well. Now, Hamela, I told you 4 words at the beginning. Can you repeat those back to me? Meow, 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 meow. Perfect. Okay, so patient's recent memory is intact as well. So this concludes my physical assessment at this point. I also am not seeing any jugular vein distension. Okay, that concludes my video. Thank you.